Hello everybody, I am Dr. Neeraj Gupta. I am a senior consultant at Indian Spinal Injuries Centre, Vasant Kunj, New Delhi. So today we are going to discuss upon cervical spondylosis. So basically cervical spondylosis is not a disease. It's a very common problem and it's an age-related thing. So 80% of the population above the age of 60 years is having cervical spondylosis. Cervical spondylosis is nothing but just the wearing and tearing of the tissues. So what is cervical spine? So cervical spine is basically it's a portion of your spine which is in the neck part, that is between the head and between your chest, and it consists of around 7 bones. So these are 7 bones of the spine, which constitutes the upper 7 bones, which constitutes the cervical spine. So these are small bones 1, 2, 3, 4, 5, 6, 7. So these 7 comprise the cervical spine. And between each of the 2 bones there is a small cushion-like structure which is called disc, intervertebral disc. Between 2 vertebrae, between 2 bones is the disc. And as we see from behind, these are the part of the cervical spine bone, which we can feel on our back. And between these 2 bones, 2 important structures are coming. One is the thick nerve from the brain, which is coming from the brain down up to the lower part of the cervical spine, of the whole spine. It is traveling in whole spine. That is called spinal cord. And at each level from the spinal cord, small nerves are coming out. You can see these yellow nerves which is coming from between 2 bones. There are small holes from which these small nerves are coming out. So there are 2 important structures. One is the thick nerve which is coming from the brain going down, and from each level between 2 bones at each level nerves are coming out from both the sides, from the right side and from the left side, and they supply your upper limbs. It means both the hands, both the forearms and hands, which are supplied by the cervical spine. So this was about the structure of the cervical spine. So what happens with aging? What is cervical spondylosis? Cervical spondylosis is basically just the aging, the wear and tear. Like with age, what happens? This disc, which is between 2 bones, this soft structure, there is thinning of this disc. This disc starts degenerating, dehydrating, and there is extra bone formation. Which is causing this extra bone formation will cause the stenosis. Stenosis means narrowing of the passage from where these small nerves are coming. So when these nerves are pressed, they cause pain the stretching of the nerves cause pain in your upper limbs, pain in your neck. So this is called cervical radiculopathy. Means whenever the disc or the extra bone, when the disc get compressed, it bulges out. The disc, when this bulges out, it will compress these nerves, and when these nerves are compressed, this cause pain in the neck, cause pain in the hands. So this is called cervical radiculopathy, or what is called disc problem. You have commonly heard about patients saying that we are having problem with our C5-6 problem, C4-5 problem. So what is that? That is between C4 or C5 or C5 or C6 bones. These are the numbers of the bone. There is small disc which has come out because that disc has degenerated, that disc has wear and tear of the disc, that disc has become old, that disc is not having any power. So that disc comes out from its natural location. Now second important symptoms which occurs is this cervical problem is cervical myelopathy. Now what is myelopathy? So when this I told you another important structure in the cervical spine is spinal cord. It is the main thick nerve. Can you see this yellow main thick nerve which is inside? So when this main thick nerve is pressed, is called more symptoms. So it is called major problems. That is the problem. That is the reason for concern. So when this main nerve or spinal cord is pressed, maybe because of this disc problem, maybe because of extra bone formation, this causes the control of your body below the cervical spine start losing. So there is difficulty in walking, there is gait imbalance, There is numbness in both the legs, there is numbness in both the hands. There is a difficulty in gripping, there is difficulty in doing function, there is difficulty in passing urine, there is difficulty in defecation. So whole body start affecting. So whenever there is pressure on the spinal cord, this is called cervical myelopathy. And the third thing is only just neck pain, which is most common in more than 70 to 80% of people. After the age of 50 years, they say there is some neck pain. So that is just because the discs have become weak, the bones have started, extra bone formation is there, muscles have become weak, our lifestyle issues, this causes the neck pain, which is common in about 60 to 70% of the people, general population. So what are the risk factors? Why is this the most common problem, cervical spondylosis in young, we see now in young individual? Why it is common? Because of our lifestyle. Why now? As I told you, it's a common problem. It's an age-related problem. So why is this problem coming? The problem which used to come in 60 years of age or 50 years of age, now we usually see in individuals in 30 years of age or 40 years of age. That is because of our lifestyle. Continuous use of any device is wrong. Between after using computer or mobile, after some time you should take a round, you should do round in your office, you should do some exercises. So this is one part. Second part of our lifestyle is excessive smoking. Smoking is, it has been proven that smoking causes early degeneration of the disc. So smoking always increases your disc problems, right? Third thing is exercises. We should encourage exercises. We should learn, and we should learn proper exercises. What is the treatment of cervical spondylosis? Is there a treatment for that? Yes, there is a treatment for that. So initially we can always give medicines. You can if there is a minor disc bulge, there is nothing to worry. Surgery is not needed in every case. Only 20-25% of cases need surgery. 75% cases are treated conservatively only with medicines, with exercises, with proper care. You should always get X-ray and MRI both. X-ray usually will tell you about all the bony details, alignment of your cervical spine, alignment of your joints more clearly, and MRI will tell more about your spinal cord, your position of the disc, whether it is pressing the nerve roots or not. So both should be done, and you should consult your doctor regarding this, and never get the investigations by yourself. First consult the doctor, then get the investigations done. So if there is some pinching on the nerve roots means the small nerves which are coming out, which can cause pain in your hands. If the disc is mild bulge is there, it's mild compression is there, no surgery is needed in that. In most of the cases surgery is not needed. Only you have to take some medicines, you have to do some exercises, you have to change your lifestyle. The pain usually goes. Now if this disc is you can take medicines for at least for the conservative trial can be for 2 to 3 months. If at all pain is not going, it is persisting, then we can go for surgery. So the surgery is a very safe procedure. So you should not be worried about surgery. The technologies are advanced so much that it's a very safe surgery now. So what we do in the surgery, there are 2 types of surgery, or rather 2 to 3 types of surgeries depending upon the problem. So if it's only a disc bulge, it's a small disc which is pressing the nerve root, and it's not we are not being able to treat by medicine for more than 3 months, we can just remove this disc by giving a small incision in the small cut is placed here. We can remove this disc, we can replace it with a cage, or we can do a disc replacement, and these are all safe procedures. And now, and second thing I told you about cervical myelopathy. If you see that your pain is coming in both the hands, there is numbness in hands, you are having difficulty in walking, and your balance is not proper, there is difficulty in passing urine, all these symptoms are there, then you should be more worried. You should consult your doctor immediately. That means your main nerve, your main spinal cord is getting pressed. For that, there are different surgeries are there depending upon the site of the problem, where is the problem located. So we will not go into technical details or surgical details about that, but only I want to say that surgery is safe if at all it is needed, and in more than in 75% of the cases surgery is not needed. Only in 25-30% of the cases some surgery is needed. And third thing is your only just neck pain, which I told you is the most common. For that you have to just change your lifestyle, avoid smoking, do daily exercises, take adequate your vitamins and take healthy food, and that's all. Nothing to worry about. Cervical spondylosis is just a age-related problem. It will happen just like graying of the hair. So nothing to worry. Yeah, thank you.